I want to show everyone today in this video what we've done at the CCP to reduce COVID-19 spread in our workplace and do what we can to ensure employee and visitor safety. Here I am in the main entrance. We have a sign-in station for visitors, including a little cup for used pens and clean pens. We also have signs posted around the building talking about mask wearing and social distancing practices. We also have information on the disinfectants that we're using and where we're using them, with information about their toxicity or hazardous properties, if there are any. In addition to that, we also have a staff sign-in area with a thermometer to take our own temperatures and some hand sanitizer here. We have hand sanitizer distributed throughout the entirety of the building, including common spaces, bathrooms, and the kitchen. We also have signs that tell visitors where they can report infractions in case they find that we are lacking in any of our practices and feel unsafe. So if they don't feel safe letting us know, they can let United Way of Connecticut know by dialing 211. In addition to this, we also have daily disinfection practices in the kitchen, bathroom, and the common spaces. We are able to determine who cleaned these and when by checklists that we have distributed in these spaces. We are also requiring folks to clean up after themselves in their personal spaces, so when individual artists come in, we have disinfectants available to them so that they can spray down their areas when they're done for the day. The disinfectants that we're using are two. We're using two different kinds that were recommended in resources given to us by the Yale School of Public Health. The first is Madicide FD. It's an isopropyl alcohol-based disinfectant that is used in hospitals that we actually found from a tattoo supplier. So we found that when supplies were low in sort of like the regular marketplace, where we were used to buying products, we had to get creative with our sourcing. And we found that tattoo suppliers were a reliable source of gloves and Madicide for serious disinfecting. For the common spaces, we're using hydrogen peroxide, which is in a light, fast bottle because it is UV sensitive to UV light. And this is another recommendation that we made based on the resources given to us by the Yale School of Public Health. Finally, in addition to all of this, we also have these fans placed throughout the studios and the common spaces that has a MERV 19 hospital-grade air filter caulked to the front of a box fan. And these are actually really powerful air purifying devices that remove a vast amount of particulate from the air, particulates of very, very small size, including virus particles. So as you can see, we have these turned on and in place all around the building. In addition to that, we also drafted a full COVID-19 policy, which includes everything from a description of the virus and how it spreads, to resources on where to go to get tested, where to go if you need to talk to a therapist, we have emergency practices listed for what we would do in case there was a positive case on campus, what are the steps we would take, and all of that other information. So we have that in both a members form, so that there's a version of that policy for members only, and a version of that policy for staff as well.